Well, hello and welcome to the show. I am Melissa Slemp, your host, and today I have a question for you. If you're currently taking micronized progesterone and maybe your blood sugars are feeling harder to manage than they used to, especially overnight during stressful or more stressful times of the day or the weeks, or is in your luteal phase of your cycle, this may be something you're not doing wrong. It's just there may be some more information to what's happening, and what I'm going to share today is going to hopefully answer a lot of these questions and find you a solution to maybe some recent resistance that you're feeling since starting on progesterone. Now, the frustration can be real for women with type 1 diabetes, and today we're going to be talking about hormones, progesterone specifically. It doesn't get enough airtime. And before we jump in, I want to take a moment to spotlight an organization I really admire, Diabetes Sisters. They are a non-profit dedicated to supporting women living with and at risk of diabetes of all types. They focus on education, peer support, advocacy, and real connections. Living with diabetes can feel isolating, and Diabetes Sisters reminds women they're not alone. They offer virtual meetups, webinars, and evidence-based resources that truly reflect women's lived experiences. So if you or someone you love is navigating life with diabetes, visit diabetessisters.org to become a member. It's free to join and free to use, and it's a great place to find community and support. So just click the link right here in the show notes to visit the site and join today. Today we're going to talk about progesterone and how it can help and when it can actually create other obstacles for women, specifically with type 1 diabetes, because we are all on the symptoms, aren't we? We tend to have to be, and we are definitely close to our data, blood sugar related specifically. So let's start at the beginning with perimenopause. This is a hormonal transition and not a diagnosis. So this is definitely that time where hormones are starting to fall. And progesterone is one of the first hormones to decline. So often it's the first hormone that can and in many cases should be prescribed for women. And if you are still cycling and experiencing many of the common symptoms of depleting hormones, adding in progesterone is a common first step. And in the luteal phase, so this is days 15 through 28, so it's the last half of your cycle. Again, your cycle starts, day 1 is the first day of bleeding or menstruating, and the use of synthetic progestins or non-synthetic progesterone, and there is a difference in hormone replacement, can interfere with insulin function, similar to the body's natural progesterone, leading to higher blood sugar levels. So again, progesterone peaks and rises in that luteal phase. Adding in progesterone, it's such a tricky balance. It really is. So again, levels are important, and monitoring our symptoms accordingly are so important. And just a reminder that what I'm sharing today is from clinical research that I have found that has been privy to me and shared with me, and a client story, which I will share with you here shortly. And this is to be used for informational purposes only, and please discuss questions or what you hear on the show or any treatment plans with your doctor or hormone specialist that you're working with. So why progesterone matters. Progesterone's role in the body. So these are some of the benefits. And when it's getting low or erratic, especially in perimenopause, these are some of the things that we can notice. And that is sleep quality. So progesterone helps us to fall asleep. It calms the nervous system. It's another reason why we can fall asleep, right? It's lowering cortisol, and it's making us more adaptable to stress. So we're more resilient to any sort of stress that comes in. And it also, in this case, it can either help with insulin resistance, and like I'm going to share today, it can actually cause more insulin resistance. So stay tuned as we unpack that. And I want to connect the physiology of what's happening with this hormone. Again, I'm not a doctor. I am just reading medical protocol and some things that you can find out for yourself. And these are some things I'm going to be having in my upcoming book, Highs, Lows, and Hormones, too. So stay tuned for more as we have clinical expertise and guidance in the book. And this is definitely a topic that will be covered in more detail, so stay tuned. So the lived experience with progesterone, so higher overnight and or early morning blood sugars. So this might be what's happening if you happen to be taking a progesterone supplement or hormone therapy. Certain weeks may feel harder. Again, that luteal phase is so critical. It really does paint a picture during that week to 2 weeks that leads up to your cycle. Other things, poor sleep, it leads to higher cortisol. Higher cortisol leads to higher glucose. So we understand that cycle. So if progesterone is low and we don't have that in our system to help us with those things, then these other symptoms can come into play, which is, again, the higher cortisol and the higher glucose. And this is another reason why we are prescribed progesterone, because we want to be able to get a good night's sleep. Again, that is how it is. It's kind of that trickle-down effect. So better sleep, lower cortisol, lower glucose. So that's how it kind of works. And that's the pattern that it follows in our body, especially when we are monitoring the numbers like we are, us women with type 1. And this is not a discipline problem when it comes to what we're doing or not doing. So whether or not you're on progesterone and not, again, this is not judgment. This is just awareness. And if this is something you're curious about, and maybe what we're going to be talking about today or what I'll be sharing with you just kind of raises your hand. It kind of raises your eyebrow, I should say, to this might be something that could be something that you're looking at and to talk with your doctor about. So the nuance most women aren't told. Again, I just shared the benefits of taking progesterone and making sure our progesterone is at a higher level in that luteal phase or in a healthy level. Here's the part that doesn't get talked about enough. Progesterone, in simple terms, it's not about too much hormone. It's about how the brain and the nervous system, and for us, blood sugar, respond to the progesterone. Again, if this is something that you are taking in and adding into your protocol as far as taking hormone replacement in the form of progesterone. So who may be more sensitive? So you're probably wondering, is this going to be me if and when I get on progesterone? Is this something I should be looking closer at according to some of the symptoms I may or may not be having? Well, here's a couple things to look at and to consider. And this is a general term. Again, this is what clinical studies are showing and research is showing. So if you have history of PMS, so that's or PMDD, which is premenstrual dysphoric disorder, or neurodivergent. So basically what this is someone who has a brain that processes information differently. Or if and when you are using synthetic progestins, which is not the same as a bioidentical progesterone. So the synthetic are found in commonly birth control pills. So these are just some things to be aware of. And just to reinforce, this doesn't mean progesterone is bad. It just needs to be looked at in context to who you are, what you're experiencing, what your body needs, and maybe what it doesn't need. And I want to share a client story. This is really going to paint a picture. So she's in our Type 1 and Midlife group coaching circle, and she has just recently started on both estrogen and progesterone. So she's in her late phase, and again, she's early to her hormone therapy. And she expected improved sleep and steadier sugars going into having both the estradiol and the progesterone added in. Instead, she was seeing more insulin resistance and just didn't feel like herself. She knew something was just not feeling right or dosed right or dialed in right. So just to reflect what this brought up, she was confused. She had some self-doubt about choosing to get on hormone therapy, which I know can be something, I think that's something I've heard a lot of, is if and when women start on any sort of form of hormone therapy, that their initial response, physically, emotionally, in our case, blood sugar wise, is not a positive experience. So they jump off of the hormone therapy. Again, you've got to really talk to your practitioner, understand what's happening, why it's happening, and to see if there's other avenues, other protocols that you can look into. There are many options out there. And that's another reason to get with a specialist that knows how formulas are going to best work for you. So this is not a one-size-fits-all. Many women, including myself, do beautifully with progesterone. I am on a micronized dose of oral progesterone. I've been taking the same dose since day one. It's perfect for me. I've never had to increase it. It buddies up well and pairs well with the estradiol that I take as well. So I've got a good formula going with all of my pieces of hormone therapy, and I'm very fortunate with that. And that's something that took a little bit of time to kind of get that dialed in. But once you do, you know when you are feeling better, tracking the symptoms and paying attention to this. So, but some women, even though I'm having a great experience, and I'm going to give you an update on this client that is now doing better, and I'll explain what she ended up doing after getting this feedback from her body. But for some women, they need to do something a little different. They may need a different form, so micronized versus synthetic. So if this is you, think about that, the type of progesterone you may be using. A different delivery method. So oral, like I'm taking and doing very well at, versus vaginal. Yes, you can take progesterone vaginally as well. And it might be a dose change. Maybe you're taking too much. Or maybe you just need a non-hormonal support. There are many different things out there to consider. So hormone therapy doesn't have to be the only solution. And it's real important to understand how unique you are, especially also managing a chronic disease like type 1 diabetes. So just take a step back and just honor that and respect that and know that with a little bit more time and patience, you can find what's going to best work for you. So just some practical tips to notice and to track. And this is what my client did. She was very curious. She didn't panic over the information and this feedback her body was giving her with the insulin resistance that she was experiencing since starting on progesterone. So she was curious. And this group member, she talked this over with her doctor, who knew a lot about how progesterone can work or not work for some women. And she was a perfect example through what she was experiencing. So together, her and her practitioner, they decided to switch her from the micronized oral pill that she was initially given to a vaginal progesterone. And within days, her resistance was starting to dissipate. So she immediately felt the difference. The estradiol she was also taking along with this new form of progesterone were paired up together and working well together. Again, to help her sleep, her insulin resistance was obviously mitigated and calmed down. So everything was starting to make more sense. And her overall peace with this hormone therapy protocol that she and her doctor decided on and took steps towards was now starting to work. So that is everything, right? So just a few things to consider. If this is something you're going through, or maybe you are looking at doing hormone therapy sometime in the future, tracking your symptoms is so important. Looking at your sleep quality. Looking at your overnight glucose patterns, looking at your mood, your anxiety, and timing of symptoms after starting or changing hormones. Really important. You've got to be paying attention to what your body is giving you as far as feedback. It does speak to us. It is letting us know whether it's happy or it's not, or it needs a little adjustment or a lot of adjusting. In this case with my client, where she changed a whole different formula. So she went from oral to vaginal progesterone, and that, as of this recording, is working for her. And I encourage you to bring these patterns and this conversation, not just the labs or the data, to the doctor's appointments and to reinforce your symptoms and how you're feeling with them. That is the true data, especially in perimenopause. Lab values don't matter quite as much because, again, there's so much erratic changes going on, during the cycle changes and the hormonal shifts, along with the insulin resistance and sensitivity. So symptoms matter. And also to bring better questions into the exam room when you are meeting with your hormone specialist. Maybe asking, what form of progesterone is this? So if they're prescribing something, ask what it is and discuss if this is your best option. And, one of the things that I do note, and I know we do this a lot with diabetes, is sometimes we got to experiment a little bit. And the whole adage with a lot of doctors and specialists is to go low and slow. And that is always the best because you can always add more hormone or up your dose or whatever, but just starting low and slow and waiting for the response, because within a week or two, your body's going to be talking and giving you some feedback. And another question is, how might this affect insulin sensitivity? A really, really big question. Not all hormone specialists are up to date or even have the knowledge to treat women with that have type 1 diabetes, insulin-dependent diabetes. So that is something you definitely have to walk into the practitioner's office with these questions so that they're aware that not only are you looking at hormone symptoms that you're tracking, but you're also looking at blood sugar symptoms and data and trends. So that is really, really important because, again, we want any sort of hormone therapy we bring in to help, not to hurt or harm. So we want it to help us and to support us. Another question is, what are our options if this doesn't feel supportive? So again, asking about the different formulas, the different types, again, talking about that lower formula strength to begin with. Again, all these things to know about, to be aware of. So don't assume it's going to come up in the doctor's office. Have your list of questions ready and making sure that everything is looked at, answered, and that you walk away feeling understood and that your questions are received. Really, really important. And in my upcoming book, this is definitely a space that I'm going to be making for these outlier experiences. Again, these are not things as far as the progesterone intolerance it's more common than we think. And it's definitely something that needs to be spoken about and addressed and supported for those of us that may go through that. And this will definitely be one of many things that I will be covering in my upcoming book, helping women just like you feel less alone when things don't go quite as expected, right? So this isn't about rushing into hormone therapy. It's about understanding the types, what it's going to do, some possibilities of what it could shift or cause a little bit more adjustments needed in the case of progesterone. Estradiol is definitely in the same conversation. We're not talking about that specifically today, but being aware of the type of hormones, how it's going to respond in your body, why you're taking it, and the dosing and the formula. All those are really, really important things to know. And it's about noticing the patterns, staying curious and advocating for care and for a hormone doctor and other specialists that are going to listen to what you need. And just remember, you're not alone in this and doing it wrong. You're not doing it wrong. Your body is communicating and be sure to visit the links right here in the show notes to learn about my type 1 in midlife coaching circle. It's a membership style of coaching, and these are the things that we talk about and support each other with every single week and inside of our community. It's amazing. And also the podcast community. Join me over on YouTube, over on Instagram, over on TikTok. Say hello, introduce yourself, and don't forget I got an upcoming book coming on. So get on my pre-launch list. Again, check out the links right here in the show notes. You can connect with me there, stay in the loop. And if this conversation resonated with you, I would love to hear from you. Or if this brought up other questions, let me know. Those are things we can continue to be talking about, bringing the topics right here on the show so that we can get this information out there to kind of clear the air, right? Because we want to feel empowered and we want to feel like we have a say and that what we need is being addressed. So have a beautiful day. Bye for now.